Hi, my name is Dhana. I'm a physical therapist here at OMPT Specialists. Today's topic is insurance. I'd like to welcome you and our owner and physical therapist to discuss this topic, Michael Fahmy. Welcome, Michael.
Welcome, Dana. I'm Michael Fahmy. I'm the physical therapist at OMPT Specialists. We started in 2006, and here we are.
Yes. So I've been doing physical therapy as well as you for about 30 years. And I'm finding that patients alike, as well as myself, we're having a hard time understanding all the insurance benefits, changes, and issues that are coming down the line every day and almost every month. So I would like to ask you a few questions to help clarify some of these things. A patient gets a script, they bring it to the physical therapy clinic, to your front office, and at that point, do they look into insurance? How does it go for the patient?
So when a patient have a prescription from doctor and they want to do a physical therapy, they call us, they give us the insurance plans, and then we have to verify it first and show what the obligations, like what is the deductible, the co-insurance, the copay. Then we notify the patient upfront so they know what's their obligation and they don't get any surprising bills at the end. And that, of course, will bring us to the definitions of all these terms.
So you had mentioned copay. So
Yes.
can we start there?
Well, let's start with the deductible.
Deductible.
So deductible is the first thing. Deductible means there's a certain dollar amount that the patient have to pay first before the insurance can pay anything. So if you go to the hospital or urgent care, or you do imaging or MRI, or you do physical therapy, you have to meet that deductible first before the insurance makes any payment. So if you have $500 deductible or $5,000 deductible, you have to pay this first, and then the insurance will start making some payments. Then you said the co-insurance. The co-insurance, when you finish the deductible and the insurance starts to make some payments, they would not pay 100%. They will pay a percentage, let's say 80%, and then you still have a 20% to pay. That's called co-insurance, and it's a percentage.
And then the third thing you had mentioned is a copay.
Copay is a flat rate. So if you have a copay in your insurance, that means it's a flat rate. It's $20, $10, $30. That's when you go to your doctor every visit and you pay that a flat rate regardless. It's not a percentage like the co-insurance. So you can have the three, you can have two of those, you can have one. So if you have a deductible, let's say $500. Let's say the physical therapy benefits, the visit is $100 a visit. Then the insurance will say, okay, you need to pay the first $500. So in the first 5 visits, you're paying the $500. Then we go to the next 5 visits. The insurance say, okay, you satisfied your deductible. Then we're gonna pay the $100 a visit, but we will pay 80%. So you still pay the co-insurance 20%, let's say $20 a visit. If you have a copay, you probably would not have a co-insurance. So it will be just the deductible and then a copay, $10, $15, $20, whatever it is, every visit. That's the copay. Now, if you add all the three, deductible, co-insurance, and copay, then that will add to something called out-of-pocket max. So if you go to the doctor, you go to the hospital, you do imaging, you do physical therapy, and you paid all this money they're asking for you for deductible, you pay for the co-insurance, you paid for copay, to what level? That level, or the highest paid, is what it's called out-of-pocket max. After you hit the out-of-pocket max, you're not paying any other you're not paying a penny. The insurance will pay everything 100%. That's called out-of-pocket max in the insurance.
Now, does this hold true for all commercial, Blue Cross, Medicare, Medicare Advantage plans?
The definition is correct for all the insurances. So if it's a deductible, it's a same understanding across the board. If it's a co-insurance, same understanding. But every insurance is different. For instance, when you say Advantage, that follows Medicare, they will have a fixed deductible, which usually $250 or something. And then after that, it depends if they have co-insurance. Usually they don't, but they will have a copay only. And they would not have a high deductible like other commercial insurance. You might have other commercial insurance that will be maybe up to $5,000. You can't have that high deductible with Medicare Advantage. So it really depends, and that's why at our company we do verify the insurance first to know where they at with the deductible, where they at with the co-insurance before they start the physical therapy.
Oh, very good. So if somebody wanted to go to physical therapy 1 month, 2 months, maybe 12 months, how do you determine when a patient would stop physical therapy or if they need to continue?
So physical therapy is a benefit in your plan, right? So it depends what your plan says. Some plans will say 30 visits a year. Some plans will say 60 visits a year. Some plan will say unlimited, but they all say one small word with a small font that you see. It depends on medical necessity. And that's where the gray area. Who defined the medical necessity? So the doctor can define medical necessity and saying prescription, but the physical therapist is the most one that have to define the medical necessity and how many visits are required per the benefit. Now, if you have, let's say, 60 visits, when you come to us and you have an ankle sprain or just a mild low back pain, that doesn't mean that you can do the 60 visits all at once. The therapist will have to do evaluation. Then they determine if medical necessity needs you to be 5 visits, 10 visits, 12 visits. And we start, for instance, when we talk about OMPT, we start with going into detailed evaluation, doing more of hands-on and manual therapy, and transition you into the exercise more. That way, we're trying to limit the use of visits so we can save you visits down the road. So let's say you came again with ankle sprain in January, and you have only 30 visits, and I used all the 30 visits. Then what happened if you slipped and you broke your leg in April or May? Not that I hope that you will do it because we need you at the clinic. Then you're out of luck. You don't have visits. So we have to be very conscious about the visits. We're trying to do of course, the manual therapy, but transition the patient into independent exercise quickly so they can continue on their own or they can use our gym in the clinics. Again, depends on the number of visits in the plan and depends on the definition of medical necessity.
So it sounds like you're customizing plans to help the clients and the patients so that they can maximize their benefits.
Yes. So when it comes to our model in the company, yes, we do verify before any start of the therapy, so no surprises. And the physical therapist here, as you were my mentor at Oakland, all the physical therapists goes to the 2 years extra education to learn more about orthopedic manual, to be specialized in orthopedic and manual hands-on through Oakland University. That gives us the upper hand of understanding the problem, going to the deep root of the pain. And why is this important? Because once we know the exact problem, we can treat it and tailor the plan of care. And that, in return, will make us able to transition you from manual after maybe a session 2 or 3 and going into the exercise, maybe hyper between manual and exercise. And if we finish and get the outcomes within 10 visits or 12 visits, then you're saving money. And unlike, unfortunately, where other providers in the area that might take the shortcut, which is I'm doing the eval, I'm drafting the exercise, I don't see you anymore, and you come in here and you're just working out and doing the exercise, and let's see if you're doing good or bad. And always I question this and I say, if you're able to do the exercise on your own every single visit and you never see the therapist, then why don't you go to a gym and just do those exercises for cheaper membership than coming in here and paying what we talked about, the deductible, the copay, the coinsurance. So use the physical therapy as a patient if they're providing skilled care. And we are providing skilled care because of our specialty, the manual. The minute you can do the exercise on your own and you don't need the hands-on and you start to do exercise on your own in the clinic, start talking to your therapist about shifting to how you do the exercise on your own in a community center, in our clinic, or going to a gym.
Sounds like you have this down. In the sea of all the clinics that are opening, I see physical therapy clinics on every corner and every strip mall now, and I think you did a really good job of explaining what makes OMPT stand out and a little different. Is there one suggestion that you would give to future consumers, or one question that you could tell if you were a future customer looking for a physical therapy place? What would be like 1 or 2 questions they should ask when they call?
Number 1 rule, shop around. If you're buying anything right now, usually 10, 15 years, 20 years ago, of course you didn't born at that time, but they can go to the stores and one store, buy the merchandise from it, and that's it. Now I go to the store, I see what I want to buy, then I'm hopping on the phone and looking at Amazon, looking at other websites to see where is the best deal for that, right? For physical therapy, it may not work the same about the prices because it's the same from the insurance, but you're gonna go and ask for a free consultation. Ask to talk to your therapist. talk to the therapist and question him. And we welcome this, by the way, if you want to do the free consult in our clinics. And you tell them, okay, what's your expertise on this? How many patients you've seen with those diagnoses? Are you seeing me one-on-one? And are you starting with one-on-one and then we're doing some of the exercise? How you transition me from your care to me to be more independent? And you're smart enough to know from the answers, do you feel comfortable coming to this clinic or the other clinic? There's a lot of good providers out there. And I'm hoping that when you go and just shop around, you can see that physical therapy in general helps with the pain better than going into a surgery. But if you want to take it one notch above, then that's where OMPT Specialists stands above the crowd.
So it sounds like your company offers a unique opportunity for the patient to come in and talk to a therapist one-on-one.
Absolutely. You just call
no
and ask
cost.
for a free consultation.
Wow, that's wonderful.
There is no obligation. You can sit with the therapist and talk to the therapist and understand how would he or she tackle this problem. And you can make the decision right after that, after the free consult.
Wonderful. Is there any unique home exercise programs that are around the corner? I know there's a lot of shopping that you have to do and different companies providing exercises. Is there something unique on the horizon with home exercises?
Yes. So there is a lot of softwares, as you know, and a lot of companies utilize different programs. But we're trying to use a unique program that used in Europe a lot for hospitals and orthopedic, and it's really started to expand here in the US. It's called the Move Up. This program enables us not only to prescribe home exercise, but to message back and forth between the patient and the physical therapist. The insurance companies are still new for this, and they're trying to see if they're going to cover it or it's going to be private pay, but mostly now Medicare cover this at least. And it's like telehealth model. The advantage with this software that we're using, that your physician, the orthopedic surgeon especially, can log in, and it's free, and they can see all the exercise that the therapist did it with the patient. They can see the questionnaire that you as a patient answered. How much pain level do you have when you did this exercise? How much pain you have in the morning? And they can look at overall progress, the chart or curve of pain over a week, over 2 weeks, over a month. So they have a better idea when they do follow-up visit with you. Any other softwares might provide the same home exercise program, the messaging back and forth, but they don't provide the access to your physician only to your case. So that's an advantage, and I like that system. So we're implementing this in the clinic this year.
Wonderful.
Thank you.
Well, it sounds like you've given us a lot of information. You've answered a lot of questions for me as a person who's actually been in the industry for a while. I don't know if there's any last advice you'd like to give on insurance, or if we've pretty much covered it all.
Yes, just feel free to call for a free consult. Ask questions if you don't understand the insurance coverage. Try to know the details of the coverage, and we have a great team that will explain to you everything about deductibles, co-insurance, co-pay. The therapist can sit with you and tell you how they will tailor the program to get you the best outcome and to save money. If you're transitioning more independent toward the exercise, then the less visits that you need and the less money that you can spend or pay out of pocket.
Wonderful.
So, thank you.
So I hope that we've answered some questions for you today about insurance. And if you're a future patient looking to go into physical therapy, we hope certainly that you can take some of Michael's advice and give us a call for a free consult at 248-353-1234. Also, you can see us on social media, on YouTube channel, and feel free to email us at omptspecialist.com. Thank you very much.